Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest highlighted to us is the lower left first molar, second molar, and third molar. The first molar is an edentulous ridge. The quality of the bone looks adequate. The second molar and the third molar appear to be grossly carious. This is the sagittal view. On the sagittal view, this is the edentulous area, the inferior alveolar nerve, the lower left second molar, and the lower right third molar. Now, this is a segmental CBCT, so hence we were not able to get the apex, but nonetheless, we will be taking you through all the pathologies and all the landmarks of this tooth. So now moving to the first molar region. In the first molar region, we've got very good quality D2 level bone. We've got good cortical plates. We've got a very healthy cancellous bone. And if we can measure the ridge for our kind doctor, so approximately 6 of ridge width, and we've got a very good approximate length of 14 from the crest of the ridge to the inferior alveolar nerve. Now, this is adequate space for implant placement. We've got healthy bone, we've got excellent conditions, we don't have any pathologies. So, this is a very good section. So, if we can take you to the apical section, this is the apical section of the ridge. The ridge looks very nice, there's no buccal or lingual defect, or the lingual fossa does not appear to be very deep. Moving to the lower left for second molar, the second molar appears to have a radiolucency associated with it. This is the periapical radiolucency, which is extending and going all the way up into the buccal cortical place. So this is the buccal space, this is the lingual space. So here we can see that there is a radiolucency or a pathology that is associated from the buccal aspect to the mesial and the distal root. So this is the mesial root. It does seem to be curved. We've got two very nice canals which join to form one canal at the apex. We don't see any major signs of fractures in the mesial root. Moving to the distal root, we've got one single large distal canal which starts as two and then joins to form one at the apex right here. The radiolucency is associated with the apex. We're presuming this tooth to be non-vital and a perio-endodontic lesion can be seen. If we look at the tooth from an axial point of view, we do not see any cracks or any pathologies in the tooth. We're moving down from the crown to the apical region. No, I mean, this could be one line, but it could be a radiographic artifact because the radiolucency is associated with the buccal space. So this is the apex, the radiolucency is right there. It continues, and then opens up on the buccal cortical plate. And then as we move, this is the crown section. So we're presuming this to be a perio-endo lesion. The distal aspect of the molar, which is the sublingual aspect, also seems to be slightly associated with this lesion. The lower left 8 is very significantly cavitated as well. There we go, we can see it right there. If you move it to the transaxial view, so this is the lower left third molar. It is mesio angular, and we can see that the crown structure is above the bone level. And as we move to the root structure, we can see that it is embedded in the bone from both sides. And right close to the apex, we can see it is quite close to the apex of the tooth is close approximately 0.8 millimeters to the inferior alveolar nerve canal. So if you need further information regarding the apex and the nerve, we can conduct a full mouth CBCT. But so far we can see that the apex appears to be further away, but the roots are further away, the crown is further away, but the apex might be in close approximation to the inferior alveolar nerve. So this is the overall CBCT. We can even tell you the working length of the distal canal is approximately 20 millimeters, whereas the working length of the mesial canal should approximately be, just measure that, there we go, should approximately be 20 millimeters as well. So let us know if there are any further questions. We will be happy to help. Thank you very much.